A growing number of doctors, nurses and paramedics from Africa are making their way to Europe, America and other parts of the world. In Nigeria, for instance, the Medical Association reports that no less than 700 health workers leave the country annually for better pay. Nigerian doctors earn between $800 and $2,000 monthly, while their counterparts in the U.S. could earn between $6,000 and $30,000 monthly. Their exit is putting a strain on the nation's health sector.
You have less doctors to cater for a large population of people. So for you to understand that properly, you could just go to any outpatient department in any government institution and see the crowds that are waiting to see a single doctor in a day. And you don't expect the best out of that doctor, that is constantly overstretched. We have a very poor patient-to-doctor ratio, based on WHO recommendations, and that doesn't give for effective healthcare delivery to the citizens.
More and more universities churn out student doctors every year. It takes about 6 years and thousands of dollars to train a medical doctor in Nigeria. 88% of them consider work opportunities outside the country, and that's mainly because they're exposed to poor working conditions exacerbated by deteriorating hospital facilities.
The working conditions for health care professionals in this country are quite deplorable. The pay, equipment and facilities to manage, to diagnose patients and manage them effectively are generally lacking in most health institutions across the country. This in itself is enough for one, after a lot of years of rigorous training, to seek greener pastures elsewhere. It's not just seeking greener pastures, but the job satisfaction also is generally lacking in Nigeria.
The WHO worries that Africa is ill-equipped to respond to the coronavirus pandemic, not far from the truth for a country like Nigeria with a ratio of 6,000 people to 1 doctor. A situation experts say calls for a state of emergency. They suggest government should pay more attention to equipping hospitals to world standards, increasing budget reallocations for the health sector, and improving welfare packages for professionals. Kelechi, Emekalam, CGTN, Abuja, Nigeria.